Hey guys, it's the Doc, and here's our next installment of the hashtag Ask Dr. Mudgil series of posts. This one comes in from Reddit, and it's a good question. Starts with a statement: rosacea treatment options. Hi, I went to a new dermatologist this morning that says I have rosacea and acne because there are a few bumps on my cheek with the rosacea, which I understand may be normal to see. The dermatologist said the only way to treat the redness is through laser treatment. Is it true that the only way to remove the redness on my cheeks is by getting a laser treatment, or are there creams that can work? Well, that's a great question. So it sounds like you went to see a board-certified dermatologist who evaluated your skin, and they recommended laser treatment for your rosacea. So without seeing your skin, obviously it would be ideal to see it in person. If you're in the New York City area, you can come see me. I'll be happy to help you out. But if you're not, like really the person examining your skin or seeing your skin can really give you the best advice. I will say rosacea is kind of a complex thing. So there's a spectrum to rosacea, and there's like various things that happen in patients who have rosacea. So I'll kind of walk you through it. So it sounds like you actually have acne rosacea, where you're getting flushing and redness, and you're getting some little pimples or bumps on your skin. The best treatment for that type of rosacea is actually a low-dose oral antibiotic, which reduces the inflammation in your skin and basically treats the bumps that are on your skin. So that's the acne part of the rosacea. And it does help to blunt a flushing tendency a bit. So typically for my patients that have acne rosacea, that's like the foundation of treatment. It's such a low dose of antibiotic that it's actually used to treat gingivitis. Like periodontists who are gum dentists will use very low dose, the medication is doxycycline, to reduce inflammation in the gums. And 30 or 40 years ago, those cohort of patients that also had rosacea started noticing their rosacea was clearing up. So we use a really low dose. Patients, like I said, patients who have gum disease take it literally for decades without issue. It's such a low dose. We do something similar with our rosacea patients. But again, it's something your dermatologist will walk you through. Now that's the foundation. In addition to that, there are some topical medications that we can use to help to treat your rosacea as well. There's various options on that front. That's kind of like the icing on the cake. Like the cream alone generally doesn't get you to the finish line, but the cream and the pill tend to work pretty well together. The pill alone, like I said, is the major workhorse here, and then the cream adds like a little oomph to that. If you have flushing, so that basically treats like the bumps and some of the flushing, some of the redness. But if you have like your type of rosacea where it's like you drink a glass of red wine and phew, your face is really red, or you eat spicy food, that flushing is actually the hardest thing to treat. And there's no like super great treatments for that, even including laser. It's not like great for that type of rosacea. There are creams though that can blunt that flush, but they work only for like a transient period. So you use the cream and you won't flush for like the next 8 hours. They're not really treating the issue. They're basically like masking it for like an 8-hour period. So like for instance, if you have to do like an important Zoom call or like meet with your boss or give a presentation and you were nervous that you were going to flush, you use this cream and it'll actually blunt that flushing tendency. Again, something your dermatologist can discuss with you. Now, the next thing is actually only treated by laser. So if you actually have the type of rosacea where you're seeing the blood vessels, you see these like basically like little red squiggly lines on your skin, that might be what your dermatologist is referring to. That can only be treated by laser, and laser works amazingly well for that. You can basically erase all those blood vessels. It's an amazing procedure. We do it all the time in my office. Now again, without seeing your skin, I can't tell you for sure if that's what you got, but if that is what you have, then it sounds like your dermatologist is barking up the right tree. So I know that was a lot of information, but I hope that answers your question. Let's get it.